Have you ever seen an adult lying on the floor, whether you are at college or any other public place, and wondered how can you help in this situation? First, you will need to assess the scene. If the scene is safe, you can go to the patient. Then you will assess the responsiveness by talking and stimulating the adult and asking if he or she is okay. Then you will look for the chest and torso for movement and normal breathing. If the patient is not responsive and not breathing, or the breathing is not normal and the patient is only gasping, first activate the emergency response by calling 911 or asking someone to call. Then try to get a defibrillator, which is also known as AED. This is mostly seen or found in public places. Then check your patient's pulse and start performing the CPR. In order to perform a high-quality CPR, you need to start the compression within 10 seconds, push hard and fast, compress at a rate of at least 100 per minute, allow complete chest recoil after each compression, minimize the interruptions in compressions, and give effective breaths that make the chest rise. Avoid excessive ventilation. Check the pulse within 10 seconds. If the patient is not breathing and there is no pulse, start a cycle of 30 compressions, then give 2 breaths. Give 1 breath every 5 to 6 seconds and recheck the pulse every 2 minutes. If there is a definite pulse but the patient is not breathing, give 1 breath every 5 to 6 seconds and recheck the pulse every 2 minutes. When the AED arrives, check the rhythm. If it's shockable, give 1 shock and resume the CPR immediately for 2 minutes. If it's not shockable, resume the CPR immediately for 2 minutes and recheck the rhythm every 2 minutes and continue until the ambulance arrives. If your patient can breathe and you feel the pulse, stay with the patient until the ambulance arrives. Keep in mind the correct updated order of the basic life support and CPR sequence, which is CAB. First, we start with chest compressions, then we maintain clear airway, then we start with the rescue breaths, which are given by mouth to mouth. Finally, performing CPR while waiting for medical assistance can greatly increase a person's chance of survival from cardiac arrest. So be a lifesaver and learn how to perform a good CPR.
Code Blue is a term used for hospital emergency which describes a critical status of a patient. It's announced as Code Blue inside hospitals when a patient goes into cardiac or respiratory arrest or any other critical medical emergency. In this situation, a rapid response team who is well certified will interfere immediately in order to rescue the patient. The nurse rule in these situations is illustrated below, and do not forget to watch the video for further explanation.